right? Knee pain and your trigger points and your lower leg. I thought about doing this video because the past 2 weeks I've had a few more clients coming in asking to be treated for knee pain, nagging knee pain that they've been having. And it's been interfering with their day-to-day activities, whether it was running or playing soccer or what have you. So typically when clients come in, I usually address the upper leg most for knee pain because quads are usually the culprit, right? But as I was going through their approach, and the ones that have been to see me a few times before, you know, still coming in with the knee pain, obviously something different is going on, right? So as I'm going through their legs, doing the assessments, palpating, I'm noticing a lot of the trigger points here. And trigger points are something that you can feel. They're like little nodules that can develop or grow in your muscles, and they can compress blood flow, nutrients, they can compress the nerves, and it can all create some type of pain somewhere else in your body, right? So in this case, your knee, you got this little tree of nerves that come here. So if you're getting trigger points in this area, it can start compressing those nerves, right? So you have your tibialis anterior, your extensor digitorum, and your peroneus right here. Your peroneus comes right here, yeah, and your tibialis anterior, right? So the homework that I would send them home with for a little bit of extra relief, or so they don't have to come and see me so often in person, is to take their fingers right up along the shin bone here, and they're going to start working their way up, right? Here, here, and stopping wherever they feel pain and holding it for about 30 seconds, and then releasing and then moving on up, right? Sometimes when you push on trigger points, they can refer pain to somewhere else, especially if they're really big ones, really active trigger points. So like here I have a fairly large one, and I'm pressing on it, and I feel it in the top of my foot right here. It's nowhere close, but that's where it's referring the pain to. Right, so I'm gonna press, maybe even dorsiflex, yeah, see? And then I'm gonna release. Dorsiflexion is what the tibialis anterior does actually. So that helps control. It also helps move your foot like this, right? So as I'm holding it 30 to 40 seconds, I'm gonna release. One of my favorite tools to use is a lacrosse ball or a Kinseo ball. I use tools a lot so I can save my hands and my fingers, because that's what I use to make a living. So the less I have to use them, I figure the longer they're gonna last. So you're gonna take your Kinseo ball and you're gonna grab onto the side of this shin bone here, and you're gonna roll it up. And wherever you feel that tender, painful spot, it's not like a bad pain, but it's a pain nonetheless. You're gonna hold it, right? You can even dorsiflex. Flex it, relax, flex it, relax, right? Then move up a little bit more. Hold it wherever there's a tender spot. Flex, 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 flex. You can use a tiger tail, your fingers, the Kinseo ball, or even a foam roller. For some more intense trigger point work, I don't know if you can see, you can use the floor and your body weight. Find where it's the most, I'm gonna use the other side because I released that one pretty good. Find where there's a trigger point. You're gonna put it down. Yeah. Use your body weight. There you go, there you can see it. Hold it and move down. Try to be slow and controlled with this because you don't want to roll over your shin. That will hurt. And hold. So since I am releasing this trigger point, when I come off of it, I feel like this warm sensation going down the front of my leg here. And that's just because it's releasing it. It's getting more blood flow to that area. It's getting more nutrients, more fluids running along, because it was all tight and constricted, blocking it. So when it gets released, it's just like more free flowing. Trigger points are extremely important to take care of, because if you guys read my blog page, you know that you cannot strengthen a muscle that has trigger points in it. So if you want to keep growing and getting stronger, keep your knees healthy, release these trigger points. See if it helps relieve you of some of that knee pain. All right, guys, I hope you guys found this helpful. Thank you for watching.